today with Powerpreneurs and how we have reinvented ourselves. And we have today a special guest, Dr. DeLon Canterbury. And success, Dr. Canterbury is something where you don't have to introduce yourself. And I was on one of the meetings with someone randomly from somewhere, and they talked about you, and I was like, yeah, I know him. So it was just so random that they knew you. So you've been doing big things. That's what it's proving. Similar things happen to me, so I totally understand. But
Yeah.
I'm still gonna have an awesome introduction from Dr. B. McCoy for you. So let's get started with Dr. Canterbury, our guest today.
Yeah, so let's go into his bio here. So, Geriatrics is a pharmacist led medication management company that focuses on helping overwhelmed caregivers stop their loved ones from being over medicated using genetic drug screening, deprescribing, and health cost saving strategies. He specializes in developing medication action plans for his patients of all ages, but with a specialty in geriatric care. Unlike traditional pharmacy, he develops a 3-month strategy to address overmedicated patients using a holistic and evidence based approach in accordance with the patient's prescriber so that there are no gaps in communication of care. He's also the founder of the Deprescribing Accelerator. DeLon envisions all pharmacists and senior care providers as deprescribing advocates, and he coaches professionals how to integrate, leverage, and monetize deprescribing into their clinical practices. Well, it's such a pleasure to have you here. With that being said, please enlighten us with a little bit about yourself and your origin story.
Oh, for sure. Yeah, I definitely appreciate you guys having me on. Excited to be here. For me, it's a twofold story. There was my grandmother who had dementia in her later ages, and well, unfortunately, she was prescribed an antipsychotic, ziprasidone, that worsened all of her symptoms. She started sundowning, wandering in the middle of the night, ringing the doorbell at 3 a.m., waking my parents up. And this was while she was actually, before, prescribed this at a nursing home, at an assisted living facility. So we kept refilling that med, not knowing that that was what was causing her harm. So it wasn't until a community pharmacist found the issue and pinpointed this error and advocated for our family. And I mean, this was like 4 or 5 months of hell just trying to figure out what is wrong with Mildred, what is wrong with our grandma. But fortunately, this pharmacist fought for us, advocated, got the medication deprescribed. And I'm fortunate to say that my grandma lived to see 90 and healthily with pretty minimal dementia symptoms. So that always rang in the back of my mind as I got into the pharmacy space and wanted to advocate and be the voice for our seniors, our caregivers. There's a whole world of people out there who don't get this type of support. So how many people fall through the cracks and unfortunately are put in harm's way? So that is the reason behind geriatrics. That's the reason behind the deprescribing accelerator. I'm literally putting this passion project and making our health system change so we can do better and integrate pharmacists into these roles.
This is amazing. Like really heart melting, and you have taken an adversity and converted into an opportunity for yourself and other people's families, because as you said, there are a lot of older individuals struggling with this, and the families don't know, right?
Yeah.
So at that time when your grandma was going through this, were you a pharmacist, or were you in school, or what was your status at that time?
Yeah, I was actually applying for pharmacy school. So I was a senior, junior at Emory University in Atlanta. So I wasn't quite able to advocate to the level I do now. However, not only seeing that in my family history, but then seeing it in the community setting as a pharmacy manager, right? I worked at Walgreens for about 5 years, and I was in a rural setting, very busy town in Henderson, North Carolina. And well, you see it all over. I'm seeing ACEs and ARBs. I'm seeing duplicate therapies. I'm seeing all this stuff, and there's only like two doctors at the time in the town. So Everyone's using the urgent care as primary care. So all these issues are coming to my counter. And the ones who were hurt the most were people that were of color or were older and also of color, or just older and white and just didn't know who to even ask for financial support, for transportation, for advice, for drug alternatives, right? So I found very quickly how depressed I was in that setting because I felt I was a part of the problem. I felt I was just passing the buck and filling 360 Percocets for people that aren't even getting any pain resolution from it. So that killed my spirit. I said, I'm not doing this for the rest of my life. And that was what got me eventually to step down, start geriatrics, and then provide this level of advocacy and empowerment that's concierge, that's for the family, that's not for the insurers, it's not for the pharmacy, it's literally for the betterment of the patient and the health system. And we all have this ability. We're all already consultants and experts. All I'm doing is being loud and proud about it. So that's what kind of originated geriatrics and got me starting my business in 2020.
This is amazing, right, McCoy?
Yeah. Awesome. So, real quickly, we want to hear from our audience members. You guys are entrepreneurs, if not aspiring entrepreneurs. So please put in the chat, who are you? What are you doing, so that we can connect and find some synergy amongst our audience members here. But back into the show here. So the very next question. So you really threw out some really great keywords that we kind of just want to define for our audience members. So please enlighten us on what is a concierge pharmacist and what is genetic testing.
Yeah, for sure. So we traditionally think as pharmacists as people attached to a product or a label or a drug, right? And so instead of just having a pharmacist count by fives and put your name on a bottle, why not see us as your own personal advocate, your own personal lawyer on retainer? And that's the model I use for my business is people have a subscription service for me and they're able to have full 24/7 access. So you're going to get meetings and follow-ups and health action plans, but you're texting me anything. If there's a medication you're concerned about, if you're worried about this genetic test, which we'll explain further, we give that full circle approach so that if the patient has a real-time issue, I'm communicating that to the doctor. And it gets to the point where I'm texting the doctor, hey, look out for this in your next visit. That is where healthcare should be. You see, this concierge, customizable approach. It shouldn't just be this one size fits all. And that's the level of fortuitousness that I'm getting. And so with that, patients love me. You know, I keep my patient client base small because I want the high quality. And because of that higher quality, I'm able to charge more for my value. And if I'm conveying value and I'm saving lives and helping them lose weight and helping them lose their, sugars or whatever, then the doctor's winning, the patient's winning, the caregiver's winning, and I'm winning because I got my joy back for being a pharmacist. So we provide a personalized approach to people. It's like just having someone who has your back, a permanent advocate. As far as genetic testing, I'm a huge fan of precision medicine and personalized care. And so we incorporate genetic testing into all of our patient services. We also educate the provider. So if the patient buys a pharmacogenomics consult with us as a part of our deprescribing action plan, this includes the patient's understanding of their meds, how their genes may have any implications and how the meds are cleared, or if there's any sensitivities to any other drugs that may not be identified. And I've found some really crazy stuff. I've found rare disorders that otherwise could have been harmful. And then the most important thing is bringing it full circle to the provider. So the provider gets a copy of the genetic report, and we explain to the provider what this may mean for the patient and how you can use this going forward. So it's really the new wave of pharmacy. It's the new wave of medicine. I mean, there are tons of tech startups in the genetic space, but this is the future of care. And for me, it's actually more of a personal health equity piece because unfortunately we're the ones, the people of color, who don't get access to these tests. So I mandate it for all my patients that are eligible, but also show that this is where we're going and I want you to not be left behind, especially if you're an older patient.
I love this. DeLon, you have absolutely blazed a trail here. You are setting example for other pharmacists who are struggling to find their purpose in the industry. Me and McCoy did, and that's why we went on the nutrition and holistic medicine side. But
Mhm.
you're actually in the dirty business and making it happen. Because
Yeah,
we try to like kind of stay away from all that, what you're doing, and we just kind of do our own thing, and then we tell them because it's not easy. What you're
no,
doing is not easy.
no,
And let's talk a little bit. I mean, you already answered why you picked geriatric and what is deprescribing. Let's talk a little bit about the program, the deprescribing accelerator that has taken off and how the cohort went. So,
sure.
we have a lot of pharmacists in our audience that could benefit from that. And who knows, they might just join you.
And
Yeah,
even caregivers, coaches, people that are just have relatives that are on a lot of medications. So he services a lot of different groups here. So we'd love to hear about it.
yeah,
Yes.
absolutely. So the deprescribing accelerator is like my passion project. So the first 2 years of business, essentially, I've been doing one-on-one concierge services, right? Now, what I'm doing is using the methods I've developed for my patients and putting it into a course so other pharmacists, other passionate clinicians can have a very easy framework on how to implement deprescribing, how to sell deprescribing, and how to monetize it, and how to integrate into care organizations. So, our 12-week program is 15 hours of CE accredited. So, social workers,
Wow.
prescribers,
I didn't know that.
yeah. We
You
actually
better
just,
press on that point right here.
well, I know it's that time of year. So 15 hours of credit if you sign up. It's a hybrid coaching digital course. So you're going to get some didactic self-paced modules along with live training on how to implement this. And the reason behind this is from what I saw in my personal patient cases, I literally put my cases into these classes. One of my hallmark cases is a patient who was on 36 meds, and we were able to deprescribe her down to 8 prescriptions. And we used a lot of the methods that are taught within our course. And it's not just a simple here's a beers list. There's a lot of steps that need to take place for this to really take place. So there needs to be trust, empathy, communication, alignment of patient-centered goals with the provider's goals. There's a lot of fine balancing, right? But this course is intended really for those clinicians who've just lost their passion for senior care, or they're tired of the system just sucking, and they're tired of being in these assisted living facilities and only have this much time to hit all these chart reviews. I'm looking for geriatric pharmacists, but really I want nurses in this. I want PAs, I want nurse providers, I want social workers. They are all eligible for CE credit. And frankly, the future of medicine is interdisciplinary. So there shouldn't be egos. And that's the whole point of this course. We actually are certified for interprofessional CE credits as well. So again, I love the idea of having different foods of thought all looking at the same patient and having the same mission. And it's deprescribing. Whether it's opioid deprescribing, whether it's dementia deprescribing, whether it's deprescribing using integrative medicine, yoga, stress, meditation, it needs to be a multimodal approach, and it needs to take multiple disciplines for this to work. So pharmacists, I feel, are so well equipped to leverage deprescribing and make this a high value thing that they can sell for themselves, and honestly make a business model out of it, which is what I'm done. So
I
that's just
love that. You've
describing it.
converted your passion into
Mhm.
your life's purpose, and now you're profiting. And, now anything is not going to feel like taxing work because everything you're doing is so like coming from the heart energy, right? That's what you're
Yeah,
doing. And absolutely love it. So, my next question was you mentioned holistic ways. So, I would love to talk a little bit about like what is that methodology, and if you could get a little bit deeper, because me and McCoy, we are into professional nutraceuticals that we
sure.
use for our patient population, or more like clients. Let's call them clients. She
Mhm.
she wants me to always say clients. So, but yeah, we would love to see if there's an overlap here and your ideas around it.
Oh, there's absolutely synergies. And I think, I absolutely have patients who prefer the functional medicine, the natural approach. But within our course, we actually dedicate Module 9 to the power of using integrative approaches. And so we look at evidence based institutes, Mayo Clinic's Brigham Women's Institute. We look at several leaders who use this, and they use methodologies that are actually clinically sound, but also low cost and effective. So whether it's food as nutrition, medicine as movement, I'm sorry, movement as medicine, simply meditating. Like one of our modules for opioid deprescribing, uh, we talk about employing virtual reality therapy. So I don't know if you guys know, but there is an FDA indicated headset that's virtual reality. They ship it to your home, 8 weeks. It's essentially implementing cognitive behavioral therapy and like distraction therapy. So people have been clinically shown to have lessened chronic lower back pain without using an opioid, with no intervention, just mindfulness. So why not have our entire force of clinicians think this way if it's already being done? So that's why I'm accelerating deprescribing into the forefront, because here's the evidence, here's what people are doing, here's how they're making it sustainable and making money. We all can do the same thing. That's my mindset, and that's what we are bringing with this group, is a passionate following. We're changing healthcare with this. I'm not stopping. I'm doing this for the
This
rest
is
of
just the beginning. This
this
is
is
just
the
the
beginning.
beginning.
Like, we're already seeing accredited after a year. I mean, this is going to be in every nursing home. There's going to be a deprescribing seal of approval from geriatrics. We're going to franchise this. This is going to be in every senior care org. This is going to be NIH funded. Trust me, we ain't stopping. This is going to be a part of the US deprescribing network. This is going to be mind blowing. And so that's why I care so much, because what happened to my grandma, what happens to my clients, my customers, my patients that I see, I cannot live and let them continue to die. I'm tired of it. And we don't do the best at taking care of our seniors here. So that's why, again, there needs to be an evidence-based strategy. There needs to be an integrative approach as well with functional med. There needs to be a balance. There needs to be a simple balance. And I don't think one size fits all. It's again, alignment of different approaches to help our patients.
So we keep hearing deprescribing, right? Which really brings this idea of polypharmacy, where patients are on 5 or more medications, sometimes well beyond that, right? So what is the ideal number of medications to take?
I mean, when we're talking about seniors specifically, we statistically know that if people are on more than 5 medications, it's considered to increase the risk of adverse events, drug interactions, falls, and it basically doubles by every 5 we increase to that number. So 5 or less is ideal. None is always perfect. So that would be nice. But I mean, there's some meds you just can't exactly get rid of, and it may be a long stretch, and there needs to be some other stuff, and that's fine. Again, we're just talking about the possibility. People don't even think that there's a timeline for meds. It's like, oh, I'm on metformin, I'm on it for the rest of my life. There's no hope. Whereas we're not only bringing hope, but we're also empowering providers to think differently against what they've been taught in school.
Right.
And unfortunately, it doesn't talk about the social issues. It doesn't talk about barriers. It doesn't talk about nutrition.
Social determinants of health. Yeah.
Yeah. It doesn't talk about nutrition. It's not enough. And in fact, if we know that people writing these scripts barely have 4 to 6 weeks of pharmacology, it's why should we expect them to know all the side effects? They don't know the side effects. So if you're able to, of course,
they can't. You can't possibly know in that much time.
You can't. You won't. You don't know it. That's why y'all are calling us for consults, and then you get mad because we don't do our orders in time for you. Whatever. But this isn't a blame game. This is an interdisciplinary approach. I think my biggest gripe is with the system. Our system wants this to happen.
Failing us.
It's for people to be sick enough to live, but not just die. We need you to live long enough so we can get you next month for your next copay. And that's the way it is. And so we are in the game, we experience it.
McCoy, I think we lost DeLon for a second, but isn't
Sure.
this
So,
amazing?
oh yeah.
Is
So this is it's awesome to really understand that this is a big issue with pharmacy, and a lot of people don't actually understand or realize that polypharmacy is a big issue. People are on more than one medication, more than two medications, five plus. I've even heard of even when I was a pharmacy student, there was a patient that I saw that was on 28 different medications, which was completely absurd to me. um and
we all have, haven't we, during our
oh yeah,
rotation?
yeah, it's completely absurd. But things like what DeLon is doing is absolutely wonderful, because not only does he train other clinicians, he trains caregivers and family members and other people that are a part of the care for that patient, right?
Absolutely, yeah. I think DeLon has internet issues, but we'll wait for him for a few more minutes. Hey, this is just the beginning. We're gonna have to bring DeLon back because I love what he's doing and it's so empowering, and we get empowered by empowering others. That's what the show is all about.
Absolutely. And I enjoy bringing guests on here like this because in a sense, they're doing this entrepreneur thing, same thing that we did. We saw gaps in care, right? And then we found a way to say, you know what, we're going to start our own business because this is a gap that we realize that we can handle. This is another gap that we can change and make a difference. And it's just so inspiring to see other not just pharmacists, but just other people standing up for what they believe in and really thinking outside of that box that we are taught that this is the way, this is tradition, this is the way it's always been done. God, I hate that. I hate that phrase. This is the way it's always been done. I don't know. This is why we just do it this way. So
I
it really
know,
takes, it
right?
really
During
takes,
rotations. Luckily, we had a very open minded approach. So, in my school, you won't believe, McCoy, after each test, we had an hour to 2 hour long discussions of entire class with the professor on how like a big cohort picked a certain answer, and then if you can justify, they will accept that as an answer. So it was such an open-minded approach. So let's say the answer was no or maybe, but like a lot of people can explain why they said yes on something,
mhm.
they will mark it yes. They're like, that's so valid. Like, no cookie cutter here. And that's why I love my school, because they introduced us to, we had an entire holistic medicine, alternative medicine, 6 week program like yours.
But
You did you go to Costa Rica?
yeah, I did, where I studied natural products. Mhm. It was amazing. But yeah, the approach that your school has, that critical thinking, that's something that took me years on my own to figure out and really
And
like,
your
we
school
learned
didn't have that, right?
we
You
learn all
guys
this
didn't have that.
knowledge. Yeah, we learn knowledge, memorize it. We have what the top 300 drugs we have to memorize, and you just memory. But it really takes just resiliency and so many other things to teach somebody how to think critically, how to apply what they've been learned, how to take it and use it, and use that thinking and that knowledge to expound and to grow and to learn new things, right, or create new things, right. So I commend your school. I wish I was given more
I
of that
absolutely
knowledge
love that
coming
part
up.
because it completely changed how we thought about things. But well, for the purpose of staying in timeline with our show, how can people find DeLon? I feel like we should leave his profile link here if we don't get him back in
Sure.
next minutes.
He's definitely on LinkedIn at DeLon Canterbury, DeLonCanterbury. And that is also DeLon Canterbury at gmail.com is his email.
It's Bury Canterbury.
Yeah, Bury.
All right. So I just posted his name on there, but we will leave a link to his thing because I don't know what happened with the internet here.
So even though the hurricane has passed, I'm actually in North Carolina, and I know DeLon very well. We have been dealing with just many different power issues. You know, trees have fallen. I actually was worried that I wasn't going to have internet today myself, even though the sun is out today. But yeah, here on the East Coast, yeah, we're feeling some different things here, and just kind of gathering our thoughts and making things happen and picking up the pieces where they have been. So even I had an event that I was supposed to do this weekend, but because of the population in Florida, we had to cancel it. It was a virtual event, but the population was predominantly out of Florida. We had to cancel that. So
I understand.
it's live.
It's right. It's live, and yeah, Dylan apologized because he said his entire internet crashed in a second, and he's not able to get back on. So I have shared his profile link. Go check out his deprescribing accelerated program because it's absolutely amazing. If that's the route you're looking for, but
Right.
we'll be here again. We'll bring Dylan again in a couple more months, and let's see like what's the next thing happening with him. And we are also doing our show, which is the counting patients to counting clients to
Counting pills to counting clients.
pills to counting clients. So basically now we're counting clients, and that
Mhm.
show from pills to clients is something that we would love to invite you for. That's happening in October, on October I think it's
The 11th.
11th. Yeah.
At 1
So
p.m. Eastern.
awesome. So go sign up for that. We'll send a lot of invites out because you can do it in a different fashion. You could take the PGX route or you can take the NGX route. And we're all about that holistic nutrition and NGX, and we love what we're doing and making the strides, right, McCoy?
Absolutely. It's not just talking the talk, but walking it as well. So we're certainly open to you guys. If you guys want to reach out to us as well on LinkedIn or any other social media, we'd be happy to just give you guys a chat and see where we can find some synergy amongst you guys as well as entrepreneurs.
Awesome. Thank you, McCoy, and thank you, Dylan, for your time. We will see you soon.